and then you add in obsessive intrusive thoughts about using, you have a recipe for disaster. Relapse becomes common, and fortunately, so does suicide. Let's talk a little bit about stats on suicide. Suicide is the leading cause of death among people who abuse alcohol and drugs. That is an incredible statistic. For addicts and alcoholics, suicide is more common than cancer, homicide, heart disease, accidents, and yet we do not talk about it nearly as much as any of those things. Individuals treated for chemical dependency are 10 times more likely to die by suicide compared to the general population. IV drug users are 14 times more likely to die by suicide. 90% of all persons who completed suicide met criteria. 90% of all persons who completed suicide met criteria for some sort of substance use disorder or other mental health disorder. 90%. That's an incredible statistic. Acute alcohol intoxication is present in 30 to 40% of suicide attempts or completed suicides. This statistic is particularly important for what we're going to discuss later. Alcohol is very dangerous for a few reasons. One, it lowers or inhibits It inhibits thinking patterns, making them less likely to fear the consequences of killing themselves, and it tends to make other drugs more potent because it occupies the liver and allows more or greater amounts of substances to get into the brain. In combination with other drugs, specifically psychotropic substances, it has been shown to cause more frequent suicidal ideations. The last statistic here, overdose suicides often involve multiple substances, including alcohol or other illicit substances. So overdosing on substances accounts for the most suicide attempts, but not the most completions. More people die by firearms than any other method. I want to talk a little bit about fables about suicide. The first fable, suicide happens without warning. This is untrue. 75% of those who die by suicide discuss suicide directly or indirectly before they die. And almost everybody gives off some sort of warning sign that we're going to talk a little bit later. People who die by suicide are physically weak or weak-minded. This is just patently untrue. Junior Seau, Andre Waters, both NFL tough guys died by suicide. Bill Walton, Basketball Hall of Famer, openly talked about struggling with suicide due to chronic back pain. Deion Sanders, I recently listened to